Well, it's a real pleasure to get up early this morning in Europe to meet my next guest coming all the way from Brisbane, Australia. Celebrity dermatologist Dr. Davin Lim is going to share with us his 3 favorite procedures to hack saggy necks and jowls. And it's something he sees all the time in his practice at Cutis Dermatology. And he'll share with us all these risks and benefits of certain treatments for women over 50. And to give you a little background on Dr. Lim, he is a procedural dermatologist who practices in Brisbane. His subspecialty interest is the management of acne scarring, as well as vascular and pigmentary disorders. So we can also talk about sun damage on older skin too. And his dermatology training was undertaken in the United Kingdom, in Ireland, Asia, and Australia. So I'm sure he sees all different skin types and can handle them all. And I found Dr. Lim on Instagram and YouTube, where he has over 1 million followers who look to him for his honest opinion on skin topics. And he does great reviews and explanations of products and procedures so we can make educated decisions on our own skin. So go check him out at Dr. Davin Lim. I'll have all the links in the show notes. And if you're not, you're going to miss out. So now, without further ado, let's meet Dr. Lim. Welcome.
Thank you very much for the introduction. So yeah, glad to actually be on this podcast, and hopefully we can share some tips and tricks with your viewers and your listeners to better their skin.
Oh, thank you. You do such a good job. It's amazing, actually, what you've done. I listened to another podcast that you were doing and how you shared your journey from marine biologist education, transitioning to a dermatologist, and then how your Instagram just exploded, and your YouTube, and your mission really, at the time, I'm not sure what it is now, but it is just to get the information out, to educate people. And it's so beneficial. I think we've been so lost for so many years. And now with internet, we can do these things, and your videos are very, very easy to follow. So before we jump into the 3 favorite procedures, has anything changed for you since you've gone viral and all these great people following you?
Well, I guess viral is probably I'm like a slow and steady kind of guy, and I try to churn out in bite-sized pieces of information basically every day. So most of my motivation is, believe it or not, is clinical. So when I see a patient with a certain disorder or complaint or skin concern, I actually go, oh, cool. Can I actually put out a useful piece of content based on that? So a lot of my content nowadays is based upon live people, which I've just recently seen. And now I find that the easiest, because instead of trying to figure out what content to churn out, I basically go, cool, what content did I just see in the last 1 hour?
Yeah, it's so practical. I always fascinated by doctors who are practicing, and you're full-time practice. I mean, you're working, and how you have the time to do this. And most, just like you, everyone else seems to say they incorporate it with really what they're doing, and it's absolutely, it's great. It's transparent, it's natural. There's no like real filters. There's just getting the information out, and that's what we want to hear. So it's your everyday life, which I absolutely love. So thank you for doing that and making that time for do that. So let's jump in then and just talk about this saggy neck and jowls, because that's what the Instagram audience wanted. Is this a complaint you get often at work?
Yes, definitely. In fact, exactly a week ago, I was involved with a roundtable discussion, a panel discussion in Sydney, and a big meeting called Aesthetics Australia. So this was brought up as in saggy neck, jowls, and I'll straight away tell you it's actually a very hard topic, because there are multiple factors which contribute to sagging. So it's not just skin, it's not just retaining ligaments, it's not just fat, basically absorption of fat with your fat pads. There's a whole heap of different things which come into play. And in order to rejuvenate, not rejuvenate from a commercial point of view, but rejuvenate from a clinical point of view, we've got to take into considerations all those aspects, including loss of collagen, elasticity, skin quality, decrease in retaining ligaments and fat pads. So it's a highly complex, I guess, field of which we're trying to improve.
Okay, so yeah, it's much more than gravity.
It's much more than gravity. It's much more than skin deep. So, when patients see sagging or complain of sagging, there's multiple causes of it. So, for example, especially in the late 40s, early 50s, you got bone resorption. So when you look at the mandible or look at the jawline, gone are the days where you have a pronounced jawline, and as a result, over time you get this resorption of bone. And what people look at in their jowls and in their lower face is actually, a lot of it is more posterior. In other words, a lot of it, there's a source. So what they see is the concern, but the source is actually back from that. So basically, it's your like I mentioned, it's your fat pads, it's your collagen, and most importantly, it's your loss of bone. And you see many people who've got jowling and heaviness, especially the lower face. What do? They basically put their finger at the anterior part, just in front of the ear, and they just push it up. And they go, wow, I wish my skin was like that.
Yeah,
So
I've done
everyone
that.
does that. A good way to understand is what you're seeing at the actual end. The source is up. It's just like a flood, right? And when you're looking at where's the source is upstream. That's what people got to understand is that the changes are not just localized, the changes are localized and also from the origin or the source.
So it's interesting. Yeah, you say the loss of bone in our jaw as well is contributing to this. And this is, yeah, as we age, yeah, we're losing that. So what is there an age that you notice this sagging jowls, or is it quite different across?
Yeah, it depends. It depends on a lot of things, including, most importantly, genetics. But when we're talking about other factors, so apart from genetics, your epigenetics, and also your exposure to UV or habitual lifestyle choices. So patients with who smoke a lot, they have an accelerated rate of collagen degradation, and then you have ethnicities, and from an ethnic point of view, generally speaking, the patients with darker skin types tend to age less, and there's a reason for that. Is partly because of their DNA, but partly because their melanin, in other words, the pigment, which is which is conducive of their skin type, protects against UV radiation. As we know, UV radiation is the one that actually breaks up your collagen.
Yeah.
So the answer to your question is that multiple factors. Certainly, age comes into play. So if I were to give an average age group, it's usually the mid-40s, and then basically people start to see a lot of it in their 50s, and then it accelerates from there. In patients who have poor habits, for example, if they don't use sunscreen, if they smoke, if they just don't look after themselves, that change might occur earlier. So in the early 40s or mid 40s. So generally speaking, the changes are accelerated for a time frame of about a decade. So someone who can look after really well with their skin, with possibly some the blessing of some good genetics, probably at the age of 55 will probably look better than the one who's 45 with lifestyle choices.
So it'll pay to protect your skin from the sun, to not smoke, to have some probably healthy eating habits, get to sleep.
That's it. So if you think about logically, that when it comes to chronological aging, it's the same as any other disease, whether it be lung cancer, prevention of cancer, inflammatory bowel disease, whether it be hypertension, obesity. It's all the same. It's all the same process. But we just need to eat healthy, have a stable lifestyle choice, and look after themselves, whether it be anything with life. Does that make sense?
Yeah, absolutely. I mean, there's a lot of face yoga people out there who also propose, like, actually there's some of their programs are about relaxing and de-stressing, because they're like, when you're stressed, your eyebrows furrow, and this doesn't help with the wrinkles and the face. And
100%. Yeah, so I totally agree with that. And it's everything that plays around that as well. So apart from just de-stressing, it's just looking after yourself. And like you said, it could be either diet, it could be, you know, things, healthy things like not smoking, and just could be something silly and as, you know, as obvious as sunscreen.
Yeah. Yeah.
Yeah.
Yeah. I was very in your videos. I was watching one of them about threading, and how you mentioned if you're not a candidate if you've been out in the sun a lot because of the destruction, I think, of the collagen inside and
Absolutely.
the fibers and stuff. And it's like, it's a pity because you kind of, some people go, oh, I'll just, buy my way out of out of it. And in fact, you may not even be a candidate if you're out there too long and does too much destruction. So
Absolutely. So even when you look at the new technology, we are limited by the biological restrictions of you know, basically nature. So even if you have powerful devices, whether it be lasers, HIFU, radio frequency, you know, really good biostimulatory threads, or even fillers, we are limited by what the body can actually produce and how the body reacts. So it's not about technology. It's about certainly technology plays a part, but the biggest role is basically your biological activity pertaining to who you are.
yeah. So let's get into your three favorite treatments for those saggy necks and jowls, and they may be completely separately. Maybe we need 6 of them. I don't know, 3 and 3.
Yeah.
But let us know, what is it? What are the things that are actually you're showing that are working with your clients? And we have to keep in perspective as well, different skin types, Asian, Black, white, like, I understand we all have those are different structures, and maybe certain treatments work better on one type than the other.
Yeah. So I guess when we look at the algorithm as in the clinical algorithm and not the sales pitch, you know, I've got a device and this is how it works. When you look at the real algorithm, it's more complex. And the things that not many people talk about, the reason being is that if you're a device company, right, if you're someone who's selling lasers, or whether you're ultrasound, whether you're radio frequency, part of the sales pitch is that your device has got to work on all skin types, whether it be Asian, whether it be Caucasian, whether it be African American. So it's got to work on all skin types. And then it's also got to work in almost all cases of sagginess, or in other words, laxity, whether it be mild or mild to moderate. So you can't have a laser company or an energy device company going, cool, this is how you choose the algorithm of which how we apply our device. Because from an economical point of view, from a commercial point of view, that doesn't cut the mustard.
Yeah.
So when you see someone and they've only got one device, chances are they're going to push that device, right?
Yeah.
So the algorithm is very, very complex in the context of what is the best device. So like you say, if we can backtrack a little, and as you mentioned, it's extremely important for race, yeah, because we know that patients like what I alluded to before, with darker skin types, we more than likely have protected collagen because the melanin has actually protected the skin from UVA. So it's an unfair advantage that the ethnic skin type will have a better outcome compared to someone who's Caucasian. The flip side, however, people go, oh, well, no, there is a big flip side, is that, you know, people like myself, or even darker, we have more keloid scars, more hypertrophic scars, and we tend to pigment very easily. So you can have hyperpigmentation. So the way I look at things is, you know, give a little, take a little, which means, you know, there's certain wins, but there's certain losses as well in the context of ethnicities.
Yeah. So you probably have a big toolbox of devices and
Devices, yeah,
procedures, and you need to adapt to according
adapt,
to the
yeah.
patient.
Yeah. So if I were to go right, I guess have an algorithm which is, I guess, easy to understand. It's this: if someone has got laxity, lower face laxity, in, for example, early 50s, late 40s, right?
Mm-hmm.
We have a look and we figure out, hey, what's going on, right? Is there a lot of sagging because your skin quality is bad? In other words, your collagen is broken. And from that point of view, we can actually go, cool, let's try to improve the dermis. But you've got to remember, it's not those fuzzy treatments like, Fraxel laser or microneedling. We need to actually go deep. We need to actually stimulate the collagen, and the collagen needs to contract. So unfortunately for those patients where you have, questionable skin quality, things like either a deep peel, so something like a croton oil phenol peel,
Oh,
or
what kind
whether
of peel? Sorry.
phenol peel,
A
So
phenol
phenol
peel.
peel, yeah,
What's,
so they go really deep into the skin surface, right down to the base of the dermis.
oh, wow.
But there are other peels that you guys may be familiar with, something like Jesna TCA, where you have a medium depth, but you're pushing it to involve, either the medium depth of the dermis towards the deeper side. So we might combine that with something like, deep fractional laser.
Mm,
So these procedures stimulate collagen production, and they stimulate collagen production in a way which is kind of predictable, just as long as the patient's looking after themselves, not smoking. Generally speaking, we can have a predictable outcome with that.
interesting. Yeah. So imagine you come out looking pretty red and a lot of recovery with these deep, deep peels now.
Oh yes, absolutely hideous. It's basically like a Halloween type look for about a week to 2 weeks. So
Oh,
that's
wow.
when patients have poor skin quality. So what
Yeah.
happens if they get good skin quality but sagging? It follows a totally different algorithm.
Mm,
Um, so for them, patients with good skin quality with a little bit of sagging, there are many things that we can do. Things like combine PDO threads together with gentle heating devices like radio frequency or even high intensity focused ultrasound or HIFU.
mm,
So when you look at how we apply different things, we need to take into consideration the patient's ethnicity, the patient's background skin quality, the thickness of the dermis, because we don't want to use high-powered devices. You've got a really thin dermis.
mm.
And then obviously in a real world scenario as well is, we've got to think about budgets as well. Yeah.
Yeah. Yeah, budget is a big one. We have to consider, because some of this stuff you also have to keep up, right? You don't just do it once and you're good for 10 years.
Yep.
So when we talk about jowls versus necks, and we're talking about laxity and losing that, is it the same procedures that you would recommend, or is there different devices for those two targeted
Yeah,
areas?
there's a different algorithm for that, because if you compare to facial skin, where there's a lot more hair follicles, and that's where new skin generates from. The neck, the décolletage, and the chest, totally different algorithm, because for those we can't do aggressive treatments, because once you do aggressive treatments, you increase the rate of scarring, primarily due to the lack of hair follicles, which is where new skin comes from.
Mm,
So when it comes to the neck and chest and décolletage, there are lots of treatments out there. You'll see this, every single company will push something out saying we've got the miracle treatment, but they don't. And the way we approach it is, if there's laxity, what do we do to improve the laxity non-surgically first? Yeah.
yeah.
And that could include things like, dermal fillers that stimulate collagen, and they're very predictable in their outcome.
Mm-hmm.
And then when we look at the skin quality, we ask ourselves, look, what can we use? Is it a laser device or an energy-based device? So it's along the same way as how we approach facial rejuvenation and laxity, but we have to be a lot more cautious. In other words, we might have to use 2 or 3 treatments based upon the site of which we're treating, right? So the good thing in the last couple of years, in the last probably 5-10 years, there's been a whole heap of new modalities. So when we talk about dermal fillers, there's one called Profhilo, which is available in the UK and just available in Australia. So it's been there in the UK for the last 5 years. So that filler basically stimulates collagen without adding volume, which is super important, because fillers, as you know, basically fill a void, and that's usually volumetric change. While this new filler stimulates collagen with very little in the way of adding volume, which is what you want, especially for the lower face and neck area.
Oh, interesting. So Profilo is a filler, and that would be a good thing for the jowls, you're saying, or I guess any part of the
A
face.
good thing for the neck. For the jowls, there's a couple of things that can be good for the jowls. So when you talk about, I guess if you talk about things like, for example, skincare, injectables, devices. So
Yeah.
skincare, nothing's going to help with the jowl, zero, right? Don't waste your time with vitamin A cream. Nothing is not going to lift. It's just zero. When it comes to injectables, you've got a couple of ways to approach it, right? You can approach it using something like Kybella or Belcara, which is basically a deoxychoic acid, which is basically a substance which breaks down fat. So you've got to use that. You can use that off label, and that's going to work.
What's the name again?
Kybella or Belcara.
Carbella or Belcara. Okay, I'll have to look up these and put it in the show notes.
It's the same company that makes Botox, Collagen.
Oh, I see. Okay. So it's a toxin?
It's called a bile acid, which is basically your bile acids break down fat. So this is deoxychoic acid.
Oh, wow.
So if you really, people out there like natural skincare, this is actually one of those things where, you know, therapeutically it's natural because it's a synthetic variant of a chemical, which is exactly the same as what you have in your bio.
Yeah. Interesting.
So that can help. And then we can use energy devices as well. Energy devices, things like lasers, but to go deeper, we probably want to use something called HIFU, high intensity focused ultrasound.
Mm-hmm.
So when we use that off label, and we use energy devices to actually break down the fat.
Okay. Right. So you're using energy. It's a heat thing, or is it a light, or when you?
Yeah, it's heat through high intensity focused ultrasound. So it's some way heating it, but we're using that heat not only to stimulate, but we also use that heat to break down adipose tissue of fat.
Okay. Interesting.
Yeah. In the US as well, which I think is really, and I can't wait to actually get my hands on it, is a new device called Ellacor, right? Ellacor is invented by Rox Anderson, the guy who's invented fractional laser resurfacing. And what it does is that it takes tiny amounts of skin through a device, so that tiny amounts of skin include your excess skin, your dermis, your epidermis, but also have this, I'm manually removing jowls, yeah, which means jowls so that they get a good contraction, but not enough to cause scarring. So that's a new device.
Dr. Lim, I'm going to have to ask you to repeat that because it got chopped up. I think you froze for a moment. So sorry. Is it possible you can repeat it, and then I'll have my editor fix it?
That's sure. So I was about to say, in the US, you guys are way ahead compared to what we are in Australia.
Yeah.
You've got a device that can remove portions of skin without causing scarring. And it's very important because when you're looking at jowls, we not only take the top layer of skin, but we need to take a little bit of fat as well.
I see.
And that device in the US, and it's had so far pretty good reviews.
Oh, interesting. Okay. It's just technology moves so fast, I imagine, in your world. So it's, yeah. And you invest a lot in these machines, and, and then you're stuck with them for a while. Then do you want to jump onto the next one? Sounds like some of my friends who are personal trainers and gyms, and they all want the next thing. Oh wait, you froze again. Okay, there you're back. Okay, so while we're on the topic of collagen, because I didn't realize actually we'd even talk a lot about collagen when it comes to saggy necks and jowls, but obviously it's a big one. My big question is always, whenever I interview somebody and they talk about the red light therapy, stimulated collagen, or the threads stimulating collagen, or taking collagen, eating collagen, no one can give me a percentage of what's better. If I'm going to invest my time and money in trying to boost my collagen, what is the most effective way to do it? Because if it's 5% on a red light therapy and 25% with HIFU, or I don't know, some other laser procedure, then what are the numbers here, what we're talking about, and the differences? Do you understand my question?
That is a very good question, and you're to the point, which is nice. So I think that's a really good question, and I can tell you from 100% from how I feel, it's really easy. It's dermal filler, full stop. Because what we put in, we put 1 mil of dermal filler. We've got 1 mil there. So there's no ifs or buts. We've got 1 ml of hyaluronic acid where we want it. Now, everyone, when you say, oh, we're doing it, they always ask, how long does it last? Right? And I go, 2 to 3 years, and go, I want something permanent. I go, shit, nothing in life is permanent. You're after something permanent, but nothing in life is. So, when we're using stuff like red light and all the fluffy stuff, it's just fluff. And the way I look at it is that there are clinical studies that demonstrate changes which are scientifically, when we look at a paper, statistically significant. Whether the statistics can actually correlate to the clinical improvement is a very different story. So someone might show, we've got 15% increase in fibroblasts or collagen when we're using this particular, either cream or red light treatment or what have you. But does that correlate to what people can see in real life? And people will spend a lot of money on things like, fluffy stuff like, collagen cream, collagen supplement, red light treatment, or all that sort of stuff. And literally, when they spend all of that money, they could have easily invested in 1 or 2 mils of collagen of dermal filler, and that's it. You've got the correction.
And it's the Profilo one, because that's the one that stimulates more collagen, right?
Yeah. Yeah, so if you're looking at HA fillers, it's Profilo. When you're looking at things that are non-HA, there's stuff called calcium hydroxylapatite, which is Radiesse, and stuff like PLLA, which is your poly-L-lactic acid, which is Sculptra. So all of these are, you've got so much more certainty with these compared to using the fluffy stuff.
Yeah, it sounds like don't waste your time and money. Just go directly. That's my question, and you answered it so well. That's what I wanted to hear. I don't know if you know, I'm a dermatologist, and I did my studies at USC, and I had a course on the physiology of aging. And when we covered the skin, my professor, he said, when you take collagen, when you eat collagen, it just doesn't make collagen. The body just doesn't work like that. So you're wasting your money with collagen supplements. That just disappointed me so much. And I don't know how true that is, because when I think about, no, wait, if I eat more protein and there's amino acids and I've got better hair, skin, and nails, like, why wouldn't a collagen supplement work? Or why did he poo-poo that?
Yeah, I mean, once again, that's a really good question. There's 2 studies where people keep repeating as to why they work. One of it's a Japanese study that showed that patients taking dietary collagen have better skin quality, less wrinkles. Now, when we look back historically of things like glycosaminoglycans and so-called collagen-based supplementation. 25 years ago, when they had these molecules and they were giving it to patients for arthritis, there's been, it was like basically such a backlash from all the orthopedic surgeons going, well, this is crap, it can't possibly work. But we know, 5 years later, that we know that can actually work when it comes to joints, right? So when patients ask me the same question, should I go for a protein drink or powder, what have you? I go, well, it's going to help you with your joints. I still don't know the answer when it comes to the skin, and 20% of the time it's placebo. So, when you look at it from a logical point of view, you are taking a supplement which probably costs $1 or $2 per day at most. It's 100% safe. Worst case scenario, it helps your joints and decreases osteoarthritis. Best case scenario, you feel really good. And in 20% of the time, you think it's actually really good because you've got some firmer skin. So for me, when a patient asks me that's the question, that's the answer I give. It's not going to do any harm, but the worst thing that can happen is that your joints will thank you for it.
Ah, okay. Interesting. So yeah, it's still not going to give you the glowing skin and tighten up your jowls. Like, we can't expect that.
Oh, but once again, to be fair, placebo, to be fair, if a patient feels that it's done it, right? Then I go, oh, you've had a really good improvement. I'm not there to discredit your theory or discredit how you feel about it. And one of the things which always, it's an analogy. when I give someone two, jellies, one on the left, one on the right, one's green, one's red, and I ask them which is firmer, you can't tell until they actually touch, right? So one of those things which are is not qualified or quantified in scientific papers is firmness. So this is where I guess some of the industry can put a spin on words and go, 95% of patients feel firmer. But how do you test firmness? You can't. You can't look at a blob of jelly and go, well, that's firmer. You got to touch it.
Yeah.
Yeah.
Yeah. You need a bounce rate or something.
Yeah, absolutely.
Interesting. Yeah, exactly. There is that placebo effect. And also, yeah, do you notice? And that's what's the most important, right? I'm sure you get clients who come in and say, I'm worried about my wrinkles. And you're thinking, well, yeah, you should take care of your flaccity and you get some sagginess, but they don't care. That's not their focus. And it's their skin and their issues. So that's your own perspective. So I'm picking up on some 3 favorite treatments would be the profilo or fillers,
Filler.
a HIFU or a heat-based thing to tighten and firm. And
Yep.
what's your third?
Probably laser resurfacing combined with threads. Yeah. So and once again, this is based upon not what's out there. We're talking about how things are reliable. So apart from a deep plane facelift or a short scar facelift, when we talk about non-invasive, those would be my pick. But you've got to, I guess people need to understand, sometimes combination therapies are probably better off. So, it's just not one therapy. Sometimes if it's 1 + 1 = 3, not 1 + 1 = 2. So these are synergistic therapies. How I approach Jowls and how I approach laxity is basically treat every layer I can. So when I do treatments for laxity, I look at how can we improve the dermis, and we can improve it, the top part of the dermis, we can improve it using lasers, especially if someone has got a lot of sun damage. So we know that's going to work, and that's the upper dermis. Your mid dermis and your deeper dermis, we can use things like radio frequency, and radio frequency can be delivered, either with pads or RF microneedling, right? And then we look at what's below the actual dermis, which, as you know, is fat. It's the hypodermis. And when we add collagen stimulating fillers, especially for the older fillers, the level of which we place it is in the fat layer, in the subcutaneous layer. So that stimulates collagen on top, and it also helps with the fibrous septate. In other words, the fat, the network of collagen that's encompassing the fat. So when you look at combination therapies, it just makes sense because we're trying to stimulate every single layer.
Yeah, and combating different issues, like you said, the synergistic effect is key. So
Yep.
yeah, so we're talking, let's say, take one patient. I know you have an algorithm and every patient's a little bit different, but let's say the average person who comes to see you with a saggy neck or jowls, and you say, let's do a combination of the fillers and a bit of laser and or maybe the HIFU. How long do these until when did that person have to come in to see you again, and how much are they paying for this? I mean, in general, I mean, not because I know your practice may be different than what we find in Croatia or somewhere else.
Yeah. So a good way to look at things is, I guess, how I approach my patients is that it's not just one treatment and go, cool, you have this in 3 months, you'll be fine. If they need to actually build up to save up for a combination of treatments, I really would rather have that compared to someone just going, oh, cool, I'm just going to buy some, a Thermage special or whatever RF special, because we know that the satisfaction rate is going to be very low. So to answer your question, when we're looking at combination treatments, you're probably looking from an Australian dollars point of view, probably about 4,000 to 5,000. From a US point of view, it's probably about 3,000 for that. But that is high level. Well, it should be high level stuff, not just cookie color. You should have at least have a dermatologist, a plastic surgeon assess your skin and come up with a treatment plan which they may or may not perform themselves. So and if I were to give a good bang for buck, it's probably in for a more straightforward but also reproducible outcome, I'd probably go dermal fillers again. Yeah, because that is not. I guess patients got to understand this. It's a simple concept. When we're using things like lasers, HIFU, RF, we're asking patients' immune system to regenerate collagen. So that's an ask of them, right? ASK, not ARSE, so an ask. And some patients can do it well, some patients can't. Everyone, including myself, yourself, everyone lies on the bell curve. So people who generate a lot of collagens on the right, people who generate very little collagens on the left, and you hope that you're, in the middle, but hopefully it's on the right. So the answer to your question is that, there are so many different ways, but I think it's patients are better off if they actually save up, if they stop all the fluff, go to someone reputable, and they can give an outcome that's, more than likely will be to the right of the bell curve, and patients will be very happy with that.
So, okay, so I'm sure people are thinking of this as well. Like, let's figure out a budget. What do we do for the next 10 years or so? If you're 50, when you're 60, 60 when you're 70. And so there are people who, looking at non-invasive treatments or minimal invasive treatments. That's where your category is. And then there's the surgery, which is invasive. And that can be 20, 30, 40, $1,000 US for those things. So I'm sure some people are thinking, do I spread this out over 10 years on minimally invasive treatments, or do I just go for the full shebang and get a facelift? What do you think?
Okay, very, very good question. So how I approach this is that when I do fully ablative laser resurfacing, so the big stuff, it's equivalent to having a deep plane facelift. So when you have a facelift, there's two types: a short scar facelift and then deep plane. Now I tell patients this: if they want a good facelift, right, save up for a deep plane facelift by a plastic surgeon who understands not only lifting but also volumetric changes. In other words, volume as well. So to answer that question, it's hard because it depends on who your surgeon is. It depends on what you see. Now, remember, facelifts just do one thing: they lift, right? So they don't address skin quality. You can have really bad sun damaged skin, and you can have a facelift, and all it does is that it pulls the vector up, and this is why they call the Nike sign, because it's like a swoosh. Your wrinkles are basically in your cheek, and then the tail of your wrinkles are towards your ear. So once again, a facelift only addresses skin laxity. That's it. It does nothing for skin quality. It does nothing for volumetric changes or volume loss. So the answer to your question is that, sure, save up for the deep plane facelift, but you also need volume and you also need skin quality. Now, how do you balance everything out? This is my view. Deep plane facelift once in a lifetime. Fully ablative laser resurfacing once in a lifetime. That's it. Yeah. So a facelift, you might have that in the late 50s, early 60s. And if you have skin where there's skin quality issues, probably in your mid 50s or late 40s, you have a ablative laser, a crazy laser that takes 2 weeks to recover. So in between those times, you can do things which can help. I guess would say turn back time, but things which can be, I guess, slow down aging, right? And that may include all the things that we discussed, and then things like fractional lasers, which are safe, and with a downtime of maybe 3-4 days. But at the same time, volumetric. Everyone forgets volume because they think, oh, I don't like the wrinkles here, don't like wrinkles here. People don't understand that the only way to reliably improve volume is with dermal fillers. You can do that with fat transfer, but that's not a reliable way of doing things.
Oh, interesting. That's super cool. Okay, so we need to save up regardless.
I think so, but in the meantime, there's a lot of other things to do. Yeah.
Yeah, no, you're absolutely right. I did an interview with Dr. Amir Karam, and I don't know if you know, he's for that vertical restore, and he did say, we can lift, but you'll still need to get your Botox or your,
Yep.
fillers, or do the fat transfer, or, and
Yep.
use good skincare and eat well and get good sleep, et cetera, et cetera. So,
Agreed.
it's unfortunately, we always look for that magic pill. And even if you have all the money in the world, you still got to work at it. So, yeah. And, okay. So let me, before we open the panel for some questions here, I want to ask you, there was a question that was interesting. You say not everyone is eligible for some of these procedures. So let's choose one, or I don't know, in general, like what's the biggest problem? Who wouldn't be eligible for some of these things?
I guess someone, most importantly, someone who's got expectations which are way above what we can deliver. I
Okay.
think that's the most important thing. Generally speaking, us derms and plastics, we can. I mean, this is what we train for. We train for hard stuff that we need to think outside the box. Yeah. But if you ask me that question, the person who's not eligible is someone who doesn't understand the limitations of what we can do from a non-surgical point of view. All the other stuff, whether it be, autoimmune disease, or someone who's got diabetes or hypertension on lots of tablets, or all, we can actually go around that. There's no problem.
Okay, that's good to know.
Yeah, but someone who doesn't understand the limitations of what we can do, probably not a good candidate.
Yeah. And hopefully, yeah, they're seeing you or another good doctor who will be truthful with them and guide them in the right way. That's, I think, one of the most important things when it comes to all of these types of treatments. You can have the best machine in the world, but if the person behind the machine doesn't know how to use it or doesn't give the good advice, you're wasting your money. Or you could do, some pretty bad, damage to your skin and to your face. So I want to open up the panel now to anyone who has questions. Let's start with Magdalena, because I know she is a skincare expert in beauty, and she knows a lot about this. And I'm curious to hear what she says.
Hello. Nice to see you. Nice to meet you. I'm following you for quite a while on Instagram, so I know how you deliver things to the followers. And I agree with you completely, 100%, whatever you said today, because I am following these directions as well. I will be 57, and I know if you don't start with taking care of you after 40 or at 40, it could be kind of too late if you want to follow this youthful appearance. You would like to be, let me say, looking good for your age. So I don't really have any questions because you told everything. And I agree with you completely that it's not enough to take collagen. It's not enough to take a facelift or whatever, because with aging, we are losing volume, we are losing fat. So it always has to be combination of everything what you mentioned before. I only have a question. Why do you think it's better to decide for dermal fillers instead of fat transfer? This is my question. Thank you.
Good question, Lena. So just as to put things out there, I do fat transfer, yeah. So I was trained by a couple of Italians about a decade ago, and they were showing at that stage. I understand in Europe, for example, everyone is big on fat transfer. Now, there's a couple of reasons, and as you know, we always say, the predictability of a fat transfer is the unpredictability of absorption. So ideally, fat transfer should be a two-stage, operation, because the absorption rate might be 20%, the absorption rate may be 50, 60%. Now, in the context of that's fat transfer where you're doing minimal processing, so you're harvesting it by hand, when you're giving it a little wash and then you re-inject it back without much spinning and without much trauma. But then the other flip side is that a lot of people use nanofat, whether it be tulip and things like that, where they actually mix it, blend it, go through a filter system, and then you have these cells and you inject it in the dermis. Now, when I look at, it's just not me, when we look in the literature and we look at the end result of nanofat, you know, the skin quality issues with that can be so easily replicated by something like a laser. So once again, it's not about it doesn't work, it's about having a consistent outcome that's predictable. So I use fat transfer when there needs to be very huge volume losses. For example, someone who's got, you know, so atrophic and they're so skinny and you know, they need at least 15 mils of filler. I go, cool, you know what, if I put a lot of fat in here, I may save you, you know, 7 or 10 mils of filler. And that's how I approach it. So it's not that I'm against it. I pick and choose who I choose. And once again, it's the predictability. It's not about, you know, it's not about the adverse reactions and all that, because, you know, if you're safe with a cannula, you know, I think you're pretty safe with fat transfer. Now, the patients that you see where people put it up on their Instagram or their before and afters with the improvement in skin quality because of nanofat and because of the volumetric changes, remember, these patients are the best patients that they've got, right? Not the normal case. But if you do filler, for example, or someone who's got normal volume loss, so we're not talking about someone who's got, you know, 10, 15 mil deficit, someone who can, you know, do with 5 to 6 mil, you know, when you're actually doing the dermal filler, that after the treatment, plus some good time after that, you get a very predictable outcome. So that's the only reason why I do it. And to answer your question, yes, I do it, but in select patients.
Thank you. Yeah, it makes sense. So another question. I just met my friend from Miami. We were together for a few days now in Croatia, and she would need laser, for example. She is not, let me say, she's still a young girl in her 30s, but she's living in Miami and exposed to the sun nonstop. And she would like to do a laser, but she said that she was told it's better not to do it because there is nonstop sun exposure. What to suggest to these people? And I would also ask you for myself, for example, can I do a laser in summertime? Or these people who are nonstop exposed to summer or to sun, how can they solve these problems? Can they take a laser? Can they have a laser or not? What do you think? Thank you.
So once again, very good question. Very tricky because, you know, at the end of the day, when we choose who we will treat, we want to mitigate or lower the chances of adverse reactions. That's the whole idea, because no matter how good your resurfacing laser is or your technique, if the patient gets blotchy skin because of more pigment, because of post-inflammatory changes, even if you stimulate the collagen, even if you treat your wrinkles with a laser, even though they get a really good result, they're going to hate you because of that. So it's not about stimulating the collagen, it's about trying to mitigate those risks. So if someone, and once again, this is really common because when I live in Brisbane, I'm you know, we're very similar compared to San Diego and very similar compared to Miami. We face this sort of stuff all day, every day. So to answer your question, I might go, look, you know, we've got a laser that will help you. Your chances of pigmentation is going to be lower, but you know, your results may take 2 or 3 times longer. So then what I do is that I put them on something like a non-ablative laser. Doesn't work as well compared to a CO2 or erbium, but they know that, right? I'm straightforward with them and just go, you know, this will help you. It's nowhere as good, but I can sleep easy and you can sleep easy. And then when you actually have the time to protect yourself, that's when we can use another laser to stimulate more collagen. So it's not that we don't have technology, we do, but the technology itself, you know, the rate limiting factor is not the technology, it's the patient's behavior and the patient's biology.
Thank you. So is it good then to, of course, use SP 50 plus? It's normal we are using, I mean, biohackers and people who are taking care of the skin more. I think everybody is using. What do you think about this? Because now there are many people saying it's not okay to use sunscreen. It's better maybe just to take a astaxanthin or something like that, that this is like could be toxic for the skin. It's not okay. What is your opinion on sunscreen protection 50 plus SPF?
Yeah, I understand the concerns because, years ago, 15 years ago, it's a big debate on nanoparticles, whether they're being absorbed in your body, whether they accumulate in your liver, spleen, all that sort of stuff. I think that's been disproved, yeah. And the way I look at it, especially when you're looking at Caucasian patients, patients who are fair skinned living in Australia, well, they've got a 1 in 15 chance of dying of melanoma. Well, not done, 1 in 15 chance of getting a melanoma. And once you have a melanoma, you've got, X amount of, depending on the depth, how many more years you've got to live. So when you look at that and just work purely on the statistics, right? Nothing else. Sunscreen matters, and that's it. But we know that it's proven to be safe. And it's hard because everyone wants something natural. They think, oh, well, UV is natural. But we know, as a dermatologist, we know that it's not, it's not good. Sooner or later, you're going to get a cancer, right? And I guess people don't realize that in the last 300 years of evolution, 400 years, for example, yourself, you would be in somewhere in a cold country with less UVA, UVB in summer. But the last 300-400 years, there's been a huge migration of humanity, from Europe, from Europe to America, and then from Europe to Australia. So our skin type has not adapted to the environment of which we are. And it's just, I guess, when you look at it logically, you go, cool, am I supposed to be where I am at this moment in time from a genetic point of view? The answer is no, it's not. You can't evolve that quickly. So what sunscreens does is sunscreens basically block your UV because you're not supposed to be there at your location from a genetic point of view. Mm-hmm. Does that make sense?
It makes sense. Thank you so much. I think you answered everything what I wanted to know. So I'm very glad to be here with you today. Thank you so much.
Thanks.
I also encourage people to, some of these terminologies are new for a lot of people, and, this types of lasers that you're using and the fillers. That's why we have your channel. That's why we can learn and watch all your videos on YouTube. So please, I just encourage people to do that. Elena,
just as a free plug, I just finished a website, and it's just my name, drdavinlim.com. Yeah, so it's not a .au, it's .com. Now on that website, I basically illustrated things in an easy to understand manner. So, if you visit that website, I think it'll be really good because everything that we talked about, I've addressed it in that site.
Oh, really? Okay. So that's on the Davin Lim. DavinLim.com website. Yeah. Okay. Yeah. I'm going to have all of these in the show notes. I've checked them all out. But I didn't realize that's where we're going to be putting more and more of your content. So thank you. We have one more question from Elena. Do you want to unmute? She's got it in the chat here too. If she's can't talk, I'm not really sure.
Yes, thank you. Thank you, Zora, first for hosting this talk, and thank you, Dr. Lim, for this very, very informative talk. I've only recently started reading about fillers. I turned 50 this year, so suddenly had an interest in ways of improving the way my skin feels and looks, and I've been taking care of it through skincare mostly, the question that I typed in the chat to Zora, I'm going to just articulate it again, is I'm interested in the difference between the fillers that you've been talking about, like Radius and Sculptra, and what was the other, Profilo, that you said are collagen stimulating, and the other fillers that, as far as I know, are the hyaluronic fillers. What about, do they also have this property of stimulating collagen production in the skin, or do they just do that, add volume for a period of time, full stop?
Yeah, once again, very good question with that. And it's kind of confrontational if you talk about these sort of stuff with a filler company, because all filler companies probably have their own spin on their filler. So the answer to your question is that certainly all the hyaluronic acid fillers that things like Juvederm, Restylane, Bolotero, all of those fillers do actually stimulate a immune response to actually provide some collagen from from the host, in other words, from where it's injected in. Now, those fillers are best used for volumetric changes. So someone's got, for example, low volume in their temples and their cheeks. Those are the ones that once you put 1 mil in, chances are that 1 mil will stay there, and will stay there for a bloody long time. So to answer your question, is that most dermal fillers will stimulate some form of collagen, but the ones that you've mentioned, whether it be your Radius, your Sculptra, whether your Profiler, they tend to stimulate more collagen than the hyaluronic acid fillers.
All right, thank you. Thanks a lot. I've been wondering, I mean, what to invest in, and obviously because fillers like Radius and Sculptra are more expensive than the hyaluronic acid ones, at least, I think in most places, or at least that's my impression. I was wondering, what it is best to invest in.
Yeah, so how I approach my patients is this, when we're talking about different types of dermal fillers, on a day in, day out basis, I mix both the Radius together with your, normal HA. So someone comes in, let's say, late 40s, early 50s, they've got cheek deflation and loss of volume, they've got some sagginess, they've got some skin quality issues. So I'll say, look, what, a really good pick you up is basically hyaluronic acid fillers place deep on bone. So that gives you volumetric changes where the patients look and go, wow, my skin is less saggy, it's more, it's more volumized. In that filler itself, even though they say, look, last 12 months, 18 months, and all, when you look at the MRI scans, a lot of them last much longer than that, 2-3 years. So bang for your buck, having your HA filler there to displace volume and to improve things, to me, that's, it's a no-brainer, because I guide patients every day in regards to fillers versus Botox. Botox, all it does, when you take a pre and post photo, you might see that line, and that's it. So basically, you're spending a lot of money, a significant amount of money, every 3 to 4 months for a long time, probably the rest of your adult life up to the age of 65, on things which prevent wrinkles, right? When you look at filler, your 3 Botox doses can pay for the filler. But when you put the filler in someone, it's a wow effect. So it's not like, oh, I can't see it. There's a little bit of line here that's still visible. It's like, wow, that's done it. So I always try to get them to invest in something which they can see, not only see, but actually last a lot longer. So when we talk about Radius and Sculptra, those fillers can actually improve skin quality. So, but once again, if you see an expert who's really good, they might not use that filler. They might actually say, look, why don't we actually use a laser? And then that way there's an improvement in skin quality, right? So I think it's both of them are complementary.
All right. Thank you. Thanks a lot.
These are great questions. And I really appreciate you taking the time to answer all of them so well and so clearly. I'm going to have to let you go, but before I let you go, I want to make sure everybody knows where to find you. You have a website, Dr. Davin Lim, and your Instagram, Dr. Davin Lim as well, but you also have a 101.skin as well.
Yeah, 101.skin. That's, I guess, industry B2B. Yeah, so that's a little bit more complex, but I love that because it's just me just talking about my theories, mad theories on different things. And but yeah.
Oh yeah, so I was wondering, what the differences are. I like them both, and they're fascinating. So, check them out. I recommend everybody check them out. I want to go fly to Brisbane now, get some fillers. I got to get out over there, and I'm very, very encouraged that. But before I let you go, do you have any last words or recommendations for women in our 50s and our skin, or things that you'd like to share to the world before I let you go?
Yeah, I mean, the main thing is that if you're below 50 and you're listening, trust me, sunscreen and skincare is good. Over 50, you want to change. Like I say, lasers and dermal fillers, it'll do it. It'll do the job.
Oh, cool. All right. That's it. The hack for necks and jowls, lasers and fillers. And yes. That's the way to go. Thank you so much, Dr. Lim. I hope to have you on again and targeting some other feet, some other thing that we're bothered by. But I hope you have a wonderful evening tonight, and we'll hope to see you again.
Will do. Hey, thanks for the invite.